Hi, I'm Kaylee. I'm one of the physical therapists at Deaconess, and I'm here to talk a little bit about your total hip replacement surgery that you have coming up. First of all, I have a model of the hip here. It just shows your femur and then your hip here as well. Just so you can kind of visualize what the surgeon is going to do for your surgery is make an incision. Depending on the approach that they're using, this incision is going to be in a different spot. This one is for a posterior approach. They'll make an incision, they're going to either retract the muscles, move them to the side, or else possibly have to make an incision in some of them, and then also retract the ligaments as well, and open up the joint so that they're able to access the area that they're going to be replacing. Here are some of the components that they use. This is the part of the femur that they're going to be replacing. The ball is here, and then this goes down into the bone. This would be the acetabular component or the socket component, and they just fit together so that they can provide smooth movement. The metal is usually a titanium alloy, so it's strong but also light. And the plastic is a polyethylene component, and that just allows for very smooth movement along with the metal component within the joint. Generally, your hospital stay will be about 2 to 3 days, not including the day of the surgery. If it's your goal to return home, then it's certainly our goal for you to return home, and we'll continue to work with you on your mobility goals to do that. Occasionally, patients require further rehab and will stay at another facility to continue that after their hospital stay prior to returning home. If you have your surgery in the morning, we'll attempt to see you that afternoon once you get to the floor. If your surgery is in the afternoon, then we'll see you the following morning after your surgery. At that time, we'll know your weight-bearing status. Generally, it's weight-bearing as tolerated, but depending on the circumstances or what the surgeon finds during surgery, every once in a while, they adjust that accordingly. So we'll let you know what your weight-bearing status is once the surgeon, we have their orders. Each surgery has a different set of precautions that will come with it. If you have a direct anterior approach hip replacement, then you actually will not have any precautions. There is no specific movements that you have to avoid or positions that you can't be in. It's really just guided by common sense and your comfort. If you have a posterior approach, you'll have a foam wedge that goes between your legs when you're resting in bed, and that's just to help prevent your legs from coming together or prevent adduction. You're not able to cross your legs, so you can't put one leg over the other in sitting or in lying down. You're not able to rotate your foot in towards your other leg, so you're not able to internally rotate, and you want to avoid any twisting. And you're not able to flex your hip past 90 degrees, so sitting in a chair, you're not able to have your hip be lower than your knee. There should be some instructions in the booklet so you can kind of prepare ahead of time for surgery of what movements you'll have to avoid and what activities you'll have to avoid after surgery if you have a posterior approach. If you have an anterior lateral approach, then you're not able to bring your leg out to the side actively, so no active hip abduction. You're not able to hyperextend your hip, so you're not able to have your leg go past kind of a neutral position of your hip, and we'll talk about that when you're walking. And you're not able to externally rotate the hip, so we don't want you, again, crossing legs or bringing your surgical leg over your non-surgical leg. One of the most important things after surgery is keeping up with your pain medication. In order to be able to move and begin your mobility, we want your pain to be tolerable. So we expect that you're going to need to take some pain medication in order to make that possible. Make sure that you're letting your nurse know if you're having a lot of pain or if it's beginning to get to the point where you can't tolerate it, so that we'll be able to give you medication in time to get the pain under control so you're able to participate in your therapy and progress with your walking and mobility. There are exercises listed in the book, and I'd recommend that you look through those and be familiar with them and also practice them prior to your surgery so that you're familiar with them when you're in the hospital and when we start them. It definitely helps with the recovery process if you're comfortable with them ahead of time and if you know kind of how to do them, so I would recommend that. When we see you the first time, you're going to have a couple pieces of equipment that are still attached to you. You'll probably have an IV pole to take with, you'll probably have a catheter, and then also a drain from when they did the surgery. None of these prevent you from being able to get up and walk. We'll just take them with us, but we'll have to, bring them with that first time. We'll also have you start with a front-wheeled walker to begin your walking. You'll get a little bit of extra balance support and then also some assistance with weight bearing to start with to make it more comfortable for you to get moving initially. The first time you get up, you may feel dizzy, you may have some lightheadedness, you may feel a little unsteady, and we'll just take all of these factors into account when we're working with you and progress you as you can tolerate and as you're comfortable. So that's normal, and we'll expect it and just work with you as you can tolerate. We'll review your precautions with you after your surgery, so we'll help you remember what movements or positions to avoid. We'll review your weight-bearing status so that you're aware how much weight you're able to put on the leg. Generally, it's as tolerated. We'll start your mobility tasks, so we'll begin helping you getting in and out of bed, transferring to a chair, starting to walk, and then from there we'll progress to doing stairs if you need to, as far as for going home. We'll discuss your home situation with you as well the first time we see you so that we can start to prepare for your discharge planning and set goals for what you need to be able to do prior to going home. And then of course we'll initiate your exercise program, so begin the exercises with you. Each day you'll be seen twice a day, morning and afternoon, for treatment. We'll progress your mobility each session. We'll add stairs, like I said, if needed. We'll practice those. We'll continue to progress your exercise program as you can tolerate it. We'll assess your equipment needs, so any equipment that you might need prior to going home, like a walker or anything like that, we'll make sure that we have ordered and available for you prior to you going home. We'll discuss car transfers with you so that you're comfortable getting in and out of a car for going to appointments and heading home. If you have any other concerns or questions, or if your family does, then we'll certainly address those as well. Occupational therapy will also be seeing you while you're in the hospital. They'll usually complete their evaluation on post-op day 2. They'll review grooming, bathing, and dressing tasks while maintaining your precautions. Obviously those will have to be adjusted a bit after surgery in order to make sure that you're not putting yourself in a position that could possibly dislocate your hip or components. So they'll review that with you and provide equipment if you need for doing those tasks. They'll also go through bathing and then also order equipment if needed for the bath or for the bathroom prior to you going home. If you have any trips planned, any long trips or lengthy travels, returning to work, those are things you want to discuss with your surgeon. Also, returning to driving is going to be something to discuss with the surgeon. They'll be the ones to clear you for that when you're ready. Like I said, we start with a front-wheeled walker for mobility, and we'll continue with that until you're able to demonstrate that your gait is a normal pattern and that you have correct technique. We won't generally progress you down to a cane or any other device until you're comfortable with a walker, and that usually is a few weeks after surgery. So we'll start there and then make sure that your gait is normal before we progress you. Thanks.